which of the following is the most likely cause of this patient's short stature? And it looks like endocrine. So a 3-year-old boy, parents are concerned about his short stature. His growth has been consistently below the 3rd percentile for his age. Mom is normal height, father is history of short stature, normal levels of growth hormone, but low levels of insulin-like growth factor 1. Which of the following is the most likely cause of this patient's short stature? So we need to think about something that basically would have been present from birth, because it's not like he just recently dropped off. Basically what would cause normal growth hormone but low IGF-1. And it's a 3-year-old boy. So okay. Can we X off, or I guess, so I wouldn't be thinking Turner syndrome. That would be present in like a female patient. And achondroplasia is like, it's a deficient, like it's a genetic mutation, how the bones grow. It isn't with like IGF. So then I would be thinking, so what would affect our IGF-1? Does IGF-1 also work on the growth hormone receptor? That's where I might be leaning. Or hypothyroidism, if that would. Because we have normal growth hormone, so I'm not thinking growth hormone deficiency. And then hypothyroidism.
Yeah, this one, yeah, which is your gut? And then we'll kind of go through it together. This one is a little bit confusing, I think.
I'll just go receptor mutation.
Okay, so let's talk about this here. So
Okay.
short stature, normal growth hormone, low IGF. So problem with growth hormone signaling, right? A mutation in the growth hormone receptor can lead to growth hormone insensitivity or Laron syndrome. So growth hormones produced normally, but the receptor pairs unfair, leading to decreased IGF production and subsequently short stature. So this is a pretty rare, right? Rare disease. So I like how you work through it. So growth hormone deficiency, right? That can't be it, right? Because it'd be low growth hormone. Turner syndrome is usually X chromosome, right? Usually doesn't have to do with growth hormone IGF or insulin like factor IGF, right? And then hypothyroidism, right? I would say that, with hyperthyroidism, you're going to have other, other issues too, right? You're going to have like, weird faces, things like that, like cretinism and things like that. So probably unlikely here, right? Achondroplasia, right, is abnormal bone growth, like you said, right? And most common cause of dwarfism, and it's like the FGRF, right, receptor, right? And so that's not going to have to deal with the growth hormone. So definitely for sure, this is a little bit tricky. The reason why I was kind of pushing you to pick your gut is because, sometimes if you overthink it, right? Because you want to pick an answer that deals with this pathway, right? So A can't be right because that would be decreased, right? Turner syndrome that really has nothing to do with growth hormone. That's just you have one chromosome. Hypothyroidism, right? We're not dealing with thyroid labs or anything like that, right? So it is unlikely. And like you said, achondroplasia deals with bone, right? So your long bones are not growing well, right? So you have dwarfism. So B is going to be your best answer. And this is a little bit rare because it's Laron syndrome.
Okay. Yeah, I need to just go with my gut because I can talk myself out of it. Like,
Yeah.
I could have, yeah, talked myself into anything. But I also do have endocrine on my list to study because I consistently get these questions wrong. So this is good practice.